Burden of disease is a concept that describes the health state of a population. It deals with the number of life years in Germany that are lost due to death, disease, and other health-related impairments. These indicators can be used to compare the impact of specific diseases on the health of a population, and to depict it for different regions. The leading indicator used to measure the burden of disease is DALY. DALY is composed of two parts: the number of years of life lost due to disease and death. One DALY equals the loss of 1 year. Let's look at one example. Most of the residents at 20 Maple Street are healthy. Then Max dies after a stroke at the age of 75. He thus dies 11 years earlier than the statistical life expectancy at his age indicates. Anna suffers from depression and loses 0.25 years, a quarter of a year, as a result of the length and severity of this health-related impairment. The burden of disease at 20 Maple Street therefore adds up to 11.25 DALY. If this method is applied to the entire country, the burden of disease in Germany amounts to more than 25 million DALY for 1 year. Risk factors often play an important role in the development of diseases. Well-known risks are the consumption of alcohol, smoking, as well as hypertension and obesity. The environment can also pose a threat to our health, for example, through fine particulate matter or noise. The so-called risk attribution is used to determine the degree to which individual risks contribute to the burden of disease and helps to identify the need for action to improve our health over the long run. The results of the German burden of disease study are available to the general public. They provide information about which diseases result in high losses of life years, which age groups are most affected, and which risk factors play a key role. Researchers and decision-makers in public health and politics can assess these aspects, identify health needs, and thus plan healthcare and prevention measures more systematically.